Or am I even in here?
Hi everybody, this is Rachel from Terrain Dermatology. Thank you so much for joining us for our social media live CoolSculpting event. We really wanted to give you an opportunity to kind of understand the process for those of you who weren't able to join us. I have one of our patients here and she is interested in CoolSculpting, so we're going to go through the consultative process and then we're going to do an assessment and just talk about what CoolSculpting is, how it works. If you do have any questions throughout the process, feel free to go ahead and enter those in. We'll answer some of them if we have time to, and if not, then you can expect that we'll follow up with you. All right, so basically what CoolSculpting is, how it works, is a process of cryolipolysis, which is fat freezing. The applicator goes on to the area, and the reason that we like to do the hands-on assessment is so that we can determine what area or areas we're treating, the size of the applicator, the number of treatments, and that also dictates the treatment time as well as the treatment cost. So essentially that fat freezing process occurs in fat versus water and other protein structures with a requirement for less cold. Think about the butter stick in your fridge versus on the counter. If you take that butter out and it's on your counter, it becomes soft and malleable, but in a refrigerated environment, it is hardened. If you did that with a cut of meat, a protein like a steak or a glass of water, the thermal temperature changes, but the state of that matter does not. So we know that if we're bringing that temperature down, that we can bring it down so it's cold enough that the fat freezes, and that's essentially how we're able to target the fat to disable those fat cells without causing, wounding or injuring to the other cells. A very common question is, where does the fat go? So the same way that our body is able to eliminate spent nutrients, bacterial waste, these components of our immune system and our lymphatic system identify once the fat has frozen, those fat cells have sort of ruptured and crystallized. From there, our body is going to eliminate those by kind of breaking them down over a series of several weeks. So typically when we're doing repeat treatments, we can treat as soon as a month out. And then for the follow-up, we'll sometimes wait even as many as 12 weeks to allow for your body to go through that process. As we say, hurry up and wait. There's nothing special that you have to do, basically just allowing your body to eliminate that fat in the time it takes. Most people have really no side effects other than a very mild amount of tenderness or a very light amount of kind of cramping or discomfort. A lot of people say it just felt like I had a really good workout at the gym for a couple of days. And then some light surface numbness can be present for up to even a couple of weeks, which is quite normal and will go away with time. It's a very comfortable process. You come in, we have Netflix on the TV. A lot of people are working from home these days. We'll bring a laptop with a book and then just enjoy the time that they have here. When we do the assessment, I'll give you a better idea of how much time it will take just based on those applicators. And so you come in, we do the treatment, we photograph so that we have those securely in your patient file so that we can review those when you come back in to be able to see those changes happening. What questions, if anything, do you have so far for me?
If you were going to do the lateral thighs, is that done in one treatment or is it?
Great question. Unlike liposuction, where there's a regulated amount that you can take in terms of liters of fat, and obviously, when you're going through a surgical process, you're under anesthesia, there's a limit to how long you can be under anesthetic. With CoolSculpting, the nice thing is you can do kind of as little or as much as you want. It doesn't affect the body's lymphatic system and the ability for that fat to basically be broken down and circulated. I had a patient recently who drove up from northern Iowa who came in and did about 8 hours of CoolSculpting, and we did inner thighs, outer thighs, we did bra back, flank, abdomen, and upper arms all in one day. And other than just, again, feeling like she had, a pretty good workout, she was able to do everything very safely and very effectively. A person can opt to separate the treatments out. So for convenience, if a person said, I don't want to do everything today, you could literally come in the next day and have, the treatment done.
Amazing.
Yes. And then in terms of the assessment, the reason that we want to do that, as I mentioned, is so that we can feel the area. If we're talking about an area, say like the abdomen, there is, a distinction between the fat that resides above and below the muscle. So giving us the ability to feel the area really is critical, which is why we encourage our patients to come in so that we can give you, a customized consultation.
I had another question. Cellulite, that is not for CoolSculpting.
So this is the common question that comes up. Cellulite is caused by not just the fat component, but the structural tissues. We have these bands called septa, and they run in women, specifically vertically arranged. And so the pulling and tightening of those that kind of anchors down, that causes that kind of rippling and dimpling that can happen. However, if we have an excess of body fat and lymphatic fluids retained in an area, that can cause peaks and valleys. So I never make the promise, because CoolSculpting is not indicated for treatment of cellulite, that if a person's number one goal is not fat reduction but cellular reduction, that there may be better options out there. However, with that being said, I would say a good majority of our patients do see improvement, obviously, of the indication, which is the fat reduction, and because we are eliminating the peaks and helping to bring those down, that does help to just smooth the texture overall. So it's a side kind of benefit that a lot of people see.
Wonderful.
Perfect. Any other questions before we do our assessment?
I don't think so.
Perfect. What area or areas are you interested in treating?
I am interested in my lateral thighs and maybe the anterior thighs.
Perfect.
Maybe stomach.
Okay, wonderful. So what we'll do then is I'm going to do that hands-on assessment. I really want to see and feel the area. And so, with the type of clothing that you're wearing, I'm able to see and feel, through that. So I'm just going to have you go ahead and stand up for me.
Okay.
So what I'm going to do is I really want to just kind of pinch and feel the area. And the applicator that we use for this kind of lateral thigh, dare I call it the saddlebag as it's referred to, area, is roughly about this large. So looking at you, you're a really great candidate. This tends to be more dense and kind of fibrous fat than, say, the fat that can be found kind of, in other areas. So looking at you, I do think that you're probably going to be happiest with 2 treatments, although you'll see roughly about a 30% reduction with even 1 treatment. Because we are not perfectly symmetrical, we're going to take a look at the other side.
Okay.
I have actually had patients where we've done, 1 treatment versus 2 from side to side. And looking at you, you're fairly symmetric, so I do think that, we'll do the same applicators. But I can see where this pocket of fat resides a little bit further back if you haven't already noticed that. This particular applicator, because the dense nature of this fat is actually about twice the treatment time. The other applicators that we use, say for like the inner thighs, arms, abdomen, tend to be 35 to 45 minutes. This one is 75. So there are a lot of patients who do choose to simply come in and just do this by itself, since they will be here for a few hours. But again, a person easily and safely can treat multiple areas in one sitting. In terms of the technological, advancements of CoolSculpting, they continue to come out with new applicators. I will tell you that right now, the applicator that we have is suitable for treatment of this area, and then in this medial or kind of interior thigh, but not specifically here. However, with that being said, if a person's ultimate goal is just a circumferential reduction, a lot of times treating here can be complemented by treating this interior portion, so that the fit of their jeans, is better, and overall can achieve, kind of the goal of what a person might want with, this anterior portion. So if we're talking about treatment cycles, it would be 1, 2, 3, 4. The outer thigh would be 75 minutes and the inner thigh 35. A person can do them together or separately. And then we'll talk about kind of the treatment cost breakdown for you. Okay. I'll provide that in the consultation form. And then we can kind of structure a package basically to fit your needs.
Oh, wonderful.
Perfect. Yes. All right, go ahead and have a seat for me. Okay. Wonderful.
Awesome. I have one question here is, are there any areas that should not be treated?
There definitely are some, I guess, what we call kind of contraindications, for treatment, pregnancy, certain medical conditions. In terms of the areas that are indicated, through the manufacturer, the applicator is basically used for treatment of inner thighs, outer thighs, upper, lower abdomen, the broad back area, the flank or love handles, the upper arms, and the chin. So those are the areas that they've actually studied and said this is definitively safe. Now, with that being said, the same way that when Botox came out and it was indicated only for the glabella, the 11s, practitioners started using it for other areas, and that's what's considered an off-label use. We very, very commonly are treating off-label with CoolSculpting. So I have individuals where, you know, you're not going to see it advertised to the manufacturer, but we have patients who treat this inner kind of little pinch of fat in the thigh. I've had individuals who treat this sort of bulge area here. So there's no area that's particularly unsafe as long as you're a candidate, if there's the right type of fat in the area, and you don't have some of those medical contraindications that are listed.
Great. And then another question, once the CoolSculpting has been done, is the fat gone for good or can it come back?
Perfect. And actually, thank you for asking that because I forgot to mention that with Virginia. We know that when we've reached a certain stage, you know, in our lifetime, we don't produce or regenerate fat cells. And so if we're getting rid of these fat cells by freezing them, your body is not going to regenerate them. So it is one thing compared to, say, like when we do dermal filler, you know, that wears off in about a year, that you don't have to keep up with, you know, doing treatments to maintain the results. Again, we see roughly about a 30% reduction of fat cells. With that being said, you know, you'll still have some of those adipocyte fat cells remaining in the area. So if you have, you know, mild fluctuations, 5, 10, 15 pounds or so, you shouldn't really notice, you know, the fat kind of returning to the area. But if you have a significant increase in body fat, then of course the remaining fat cells in the area can retain more fat in the future. So the short answer is it is permanent. You know, the asterisk to that, of course, is that, you know, if you're having extreme fluctuations in weight, the fat cells that are remaining can, of course, engorge and take on additional lipids.
One question from Instagram, asking if we can freeze facial fat pads, if that's a possibility.
So that would be something that, you know, a person would want to come in for a consultation. Again, it is an off-label indication. There are a few applications that potentially, depending on the area, sometimes with the Cool Mini, which is the chin applicator, we can kind of treat certain areas of the lower face. So again, I would encourage coming in for a consult just so that we can really look and see, you know, if you're a candidate, as it's sort of a case-by-case basis, but yes.
Great.
Perfect. Well, thank you so much for joining. If you have any further questions after the live has ended, feel free to comment and we will get back to you with those answers. Thank you. And thank you so much, Virginia.
Oh, you're welcome.
All right. Bye.